Our next speaker is Heling Zhou. She is a senior postdoctoral in Ralph Mason's group, and the title of her talk is Monitoring Tumor Response in Vascular Disrupting Agent Using Photoacoustic Tomography and Multiparametric MRI. And the photoacoustic machine is a relatively new animal scanner that we have in our department.
I'm grateful for the opportunity to present my work here today on the newly acquired photoacoustic instrument. As Dr. Linkinski mentioned, this is still a really new technique, and it has the sensitivity of optical imaging and spatial resolution of ultrasound. For those of you who's not familiar with this modality, I want to describe briefly how it works. So when you shine the laser on the molecule absorbs the light and expands from the heat. And when you pulse off the laser, it will return to its original size. And this thermoelastic response effects will create a mechanical wave that can be picked up by ultrasound detector. And since the system knows what's the time delay between the laser to the signals detected, that you can calculate based on the speed of the sound where the range of where this molecule might be. And if you have multiple detectors, you can pinpoint this molecule pretty accurately. The most abundant endogenous contrast agent for photoacoustics in the living animal is hemoglobin. And this is an image of a cross-section of a nude mouse around the kidney area. And you can see two sides of the kidney, a little bit of spleen, and the liver and the spinal cord over here. And you can see some of the major vessels, the vena cava and the portal vein. And some of the small vasculature in the medulla of the kidney is also visible. And the resolution of this image is about 100 micron. And this whole image is acquired with one wavelength in less than 1 second. Another very useful feature of this photoacoustic instrument we have is based on this effect that molecules are not absorb the light of all the wavelengths equally. This is the spectrum of the deoxyhemoglobin and oxyhemoglobin across the wavelengths that we can detect on the system. So if you select the wavelengths carefully, and you can actually solve the equation and find out which molecule you're looking at and how much are there. And this is the example of a cross-section of the nude mouse again, and overlap of the oxy and deoxyhemoglobin map. So since we have this really new instrument, and one thing we were testing is a vascular disrupting agent. This is a part of a long-term collaboration with Dr. Penny in Baylor University. He's an organic chemist, and he synthesized several vascular disrupting agents. Oxy 697 is a tubulin binding agent that selectively targets the tumor. And what it does is it will destabilize the cytoskeleton in the tumor endocellular cells and cause the cell to round up and detach, and eventually cause the blood vessel to collapse. Since it will cause an acute vascular response, it's a very good candidate to test the photoacoustic tomography. And the study was carried out using a A549 human lung cancer rat model. We implanted the tumor subcutaneously in 4 rats. And we acquired the photoacoustics, and also we did MRI at 4.7 Tesla and the color Doppler using the Vivo 2100 system, because we have used both of them before to test VDA, so we know how we what we expect from these two modalities. Logistically, the multimodality image was performed on separate days. The first day we did photoacoustic tomography, and the second day we did MRI, where we acquired the oxygen-sensitive MRI bowed and toed, and also we did DCE with the IV injection of gadolinium contrast. And the third day is the treatment day. We brought the animal to the ultrasound, and we acquired a baseline color Doppler, and then we inject the IP of the vascular disrupting agent, and then continue repeating the same protocol of the color Doppler every 10 minutes for 1.5 hours. The first day we repeated the MR as the second day, and the last day we did the photoacoustic again. So these are the results from the ultrasound, and you can see this subcutaneous tumor that is outlined over here. You can see some of the big blood vessels on the color Doppler, but there's really not much to see because it wasn't very sensitive without the contrast. And half an hour after the VDA injection, you can already see the reduction of the blood flow and progressing over the next 1.5 hours. And by the time of the end of 1.5 hours, there's very little you can still see for the perfusion. And before I move on to the MR results, I wanted to just briefly remind you what the contrast we're looking at. Both is sensitive to deoxyhemoglobin, and told is sensitive to the oxygen molecule. Both of them are paramagnetic, and the relaxation time of R2 star and the R1 will reflect the concentration of the either deoxyhemoglobin or oxygen molecule. And from there, you have an indication of what's the oxygenation in the tumor. And this is a T2 weighted image just to orient you of the layout of the animal. The animal is lying on the ventral position. This is the spine. And the tumor is implanted sub-Q on one side of the leg. And this is the muscle, and this is the bone marrow of the knee. We see a reduction of both bold and told signal 24 hours after VDA. And the T2 star value have decreased at 24 hours, means there's more of the oxyhemoglobin, and the T1 and the T1 value have increased, means there's less of oxygen molecule. All of them are consistent with the behavior of the tumor become hypoxic after vascular disrupting agent. These are the parametric map from DCE. You can see some of the very interesting circular pattern of this tumor, indicating there's a multi-nodule structure. And K-trans and VE did not show a very consistent change. And this may mean that 24 hours after VDA, there's the permeability and the extravascular space are not changing that rapidly. But the perfusion-related parameters, the maximum intensity reached, the area under the curve, how long time it reached the maximum signal, and the slope it rise have all changed dramatically. The maximum intensity it reached become much lower, and the area under the curve is also reduced, means there's less perfusion, and it takes longer time to reach the maximum intensity, and the slope become less steep, means the blood flow has become more sluggish. This is just another example showing at 24 hours that the blood flow have decreased on the MR. And these are the corresponding photoacoustic tomography results. Just want to remind you, the images I showed in the introduction are from a mouse, and these are actually rats. And this whole area is a tumor. And you can see some of the multi-nodule structure and very high peripheral perfusion. And this tumor is about 2 centimeters across. And the top parallel is the baseline, and this is after VDA, after vascular disrupting agent. At each time point, we have the animal we occurred a series of images. We first have the animal breathing air, and then we have the animal start breathing oxygen. You can see on the deoxyhemoglobin map that the level of the oxyhemoglobin map, that the oxyhemoglobin have increased significantly when the animal start breathing oxygen. And after the VDA, the tumor become less responsive to the oxygen breathing. And these are summarizing these results. And the oxyhemoglobin level is shooting up dramatically when it's breathing oxygen at baseline, but after VDA, it's barely responding. And the oxyhemoglobin obviously behaves the opposite way as oxy. And at baseline, it was decreasing significantly when it's breathing oxygen. And after VDA, it's only have a very, very small response. So in summary, all three of the modalities shows heterogeneous perfusion pattern of this tumor, and all of them showed evident decrease of the perfusion after the vascular disrupting agent. So we found the photoacoustic tomography to be a really sensitive modality for oxygen challenge and also for the change of the perfusion. So it's very suitable for vascular disrupting agent study. And we're really excited about this new instrument. There are so much possibilities, and we welcome any collaboration, any suggestions. And I wanted to thank many people that helped with this project, especially my mentor in our group, and also Dr. Penny, who synthesized this vascular disrupting agent and handed it to us. Thank you for your attention.
Are there any questions? So I have a question. So is it possible to derive sort of a hypoxia map using this from the ratio of the hemoglobin to deoxyhemoglobin, or vice versa?
We are actually doing some of the SO2 ratio. So basically, you take the oxyhemoglobin map and overlap to the total of these two, and you get the ratio of what's the proportion of each. But one thing you need to pay attention to is since all the signals are coming from blood, so you cannot get a
So you
tissue.
don't get tissue, you just get the sort of the vascular signal.
Yes.
Raythan.
What happens if you have a deep tumor? This is superficial tumors that you're showing these images. Would that signal changes?
Well, right now the penetration depth limit is 2 centimeter.
That's all we can go.
I think they have a technical development on the to have a clinical instrument, but I think they're still looking at the superficial ones because there's although we will be able to reconstruct the image get very high spatial resolution, but it is still limited by how deep the light can penetrate. So if the lights are not going there anymore, then you're not getting signal.
Good, thank you.
Thank you.